I recognize the member from Regina Wall Shakers.
Thank you very much, Mr. Deputy Speaker. And actually, despite what the member from Saskatoon Centre said, it's a pleasure to get up and talk about our lean program that's going through not only healthcare but government-wide, Mr. Deputy Speaker. And I'm looking at their motion right here that this Assembly condemns the government for ignoring scathing criticisms from frontline healthcare workers and senior healthcare ministers, renewing the toxic and wasteful $40 million contract with the American consultant, and continue to flying Japanese senseis and paying them $35 per day while neglecting the basics in healthcare. And Mr. Deputy Speaker, I actually take quite I don't really think that this motion pays the respect it should to the work that's been done in healthcare in the last 7 years, Mr. Deputy Speaker. And I think if they want to talk about John Black and that's their pet obsession, the leader of the opposition says, I have inboxes full of emails from people that are talking about how bad lean is and how bad our healthcare system is. I haven't seen any of them. I would love him to show us some of these emails. He says people are scared to talk to government. I don't find that. I don't find that people are scared to talk to us, Mr. Deputy Speaker. And I did find one thing very interesting coming from the member from Saskatoon Centre, and I have not been elected near as long as he has, so he probably knows some things about politics that I may not. But one thing that I do find funny is when he said, when you guys are on the doorsteps in the summer, talk to your constituents, do you tell them what they want to talk about? Do you tell them about lean? Well, on this side of the House, when we go and knock on doors, we tend to listen to people. We would actually knock on a door, hi, I'm your member for the Legislative Assembly, and say, and you want to talk about this. That's probably not something that this side of the House practices very much. We go on the doors and we listen to what people want to talk about. So that may be one advice that I try to give the member from Saskatoon Centre. He's experienced, he's a veteran, he's done well in politics, but one thing that I do differently than him is that, Mr. Deputy Speaker. So one thing that I'm going to do differently as well, despite what the members opposite are doing, I'm going to go through some quotes on lean that think lean has improved our healthcare system. But one of the different things I'm going to do, Mr. Deputy Speaker, is I'm actually going to attribute names to these quotes, because people actually are putting their names behind some of the things they're telling us about lean. So I quote, I was a physician skeptic. Now I'm a physician champion for lean initiatives and rapid process improvement workshops. Dr. Ram Abdullah.
Wow.
Quote, Mr. Deputy Speaker, the biggest thing I like about lean is the do-it-now approach. If we have an idea, we trial it and tweak it as we go. People are saying, if I have an idea, it can happen. Good speech. Erica Church, continuing care aid. Quote, Mr. Deputy Speaker, I am using the patient order sets. It's easier not to forget things. I thought it would be extra paperwork, but it's okay once you get used to it. It is quite fast. Surgeons using it will make a difference. It does prevent mistakes. Dr. William Retief. Quote, Mr. Deputy Speaker, a lot of these ideas are ones the staff have had for years, and are now, because of lean, they're being able to try it. Erica Church, continuing care aid. And Mr. Deputy Speaker, that's what lean is actually supposed to provide. It comes from the ground up. It starts with patient care and the best possible patient care it can deliver. Then you go and you talk with frontline healthcare providers and take some of their ideas and try to make the system better, Mr. Deputy Speaker. I enjoy quoting people that actually put their names to paper, Mr. Deputy Speaker, unlike the members opposite, so I'm going to do a couple more. Good. There's no question we want to ensure the gold standard for all of our patients. Patients again. Who said that? Changing the way we work is hard, but this is a good example of how the hard work pays off. All of our surgical patients are now getting their antibiotics at the right time. Janet Folman, Nursing Unit Manager. Mr. Deputy Speaker, there's one more that I'd like to throw out there, and I think it's been used a couple times, but, quote, the most exciting aspect of the lean process is that registered nurses are being engaged alongside the entire healthcare team on the front end of change. This approach to reducing efficiencies while improving patient safety maximizes the collective knowledge of our frontline staff and demonstrates true leadership. Tracy Zambori, President of Sun, R2HR website, submitted January 15, 2014. Mr. Deputy Speaker, I know that members opposite have all engaged in this debate already, don't want to hear quotes with people's names attached, they'd rather go and talk about, well, I heard this from someone about something somewhere, Mr. Speaker, and they didn't like lean. Or I heard from someone that John Black, he's an evil man. People don't like him. Which Mr. Speaker, the leader of the opposition kind of reminds me of Bobby Boucher's mom in The Waterboy, if you've ever seen that, saying, John Black's the devil I tell you, Bobby. And Mr. Deputy Speaker, I think that some of the overtop rhetoric coming from the members opposite really aren't doing credit to a new initiative that the job is moving forward in the province of healthcare. I think when healthcare is looked at by many of the patients that we're serving, which we did a patient-centered approach to healthcare, which was much different to the approach. And don't worry, opposition members, I'm going to get to your lean program here in a couple of minutes. And Mr. Speaker, Deputy Speaker, I think the patient approach to looking at healthcare taken by this side of the government was a recognized change. And they want to get into the debate, so I'll bring them into the debate, Mr. Deputy Speaker. I'll talk about the lean program under the NDP.
Whoa.
The lean program under the NDP is they leaned out our youth. They made sure not a lot of our youth wanted to stay in Saskatchewan, Mr. Deputy Speaker. They leaned out our population. They made sure that highway to Alberta was packed car with vehicles from Saskatchewan. They leaned out our economy, Mr. Speaker. They made sure that they taxed business high enough that they wanted to make sure they never wanted to come back to Saskatchewan under the NDP. They leaned out our nurses and doctors. Nurses and doctors went down under their reign, Mr. Deputy Speaker, and I think that they should recognize some of the problems they've made, and we'll get to that in a couple minutes too, Mr. Speaker. And one other thing they did, Mr. Deputy Speaker, is that they leaned out the hospitals. 52 hospitals closed under them. 53 counting the Plains Hospital, Mr. Deputy Speaker. They also leaned out our long-term care home. The member from Riverdale jumps up on her chair all the time and says, what are you doing for long-term care? But we don't want to talk about what they did. They don't want to talk about what they did. They closed 19 long-term care hospitals and 1,900 beds, Mr. Deputy Speaker. You think that has a little bit to do with our infrastructure deficit going on right now, Mr. Deputy Speaker? Because I probably do. And you know, one of the things that I find interesting is their leader of the opposition jumps up from his chair every QP and talks about lean. Except during their leadership campaign, one of his promises was to find efficiencies in the healthcare sector. He never really said how he was going to do that. Well, they never said how they'll do anything. They have no policies whatsoever, Mr. Deputy Speaker. But I'd love, and the member from Saskatoon talked about I wanted to have a debate. I'd love to have a debate on your guys' policy. Anytime, anywhere, any place. You just don't have any. So that's pretty hard to have a one-sided debate, member from Saskatoon Centre. So I'm looking forward to the time when they do bring some ideas forward. And I think at some point in time, maybe the health critic, which is actually the member from Ridsdale, might be able to talk to the leader and say, you know, Mr. Leader, it's probably time that we bring some policy forward. Because I'm going out to the doorsteps. I'm going up to the doorsteps, and I'm trying to talk to people, and they're asking us what we're going to do, and I don't have any idea. So the election is about a year out, Mr. Deputy Speaker, and I think to be that unprepared for the election shows probably why there's 9 members over there and why there's 49 members over here. Mr. Deputy Speaker, I had a lot more I wanted to get to and just not enough time to get it done, Mr. Deputy Speaker, but one of the things I'd like to say is that making improvements in the healthcare sector is very important to this side, this government, and moving forward we're going to continue to try and deliver the best healthcare possible for the people of Saskatchewan.
Member from Regina Wall Chakers.
Thank you very much for the question, member from Riversdale. And because it's part of the lean process, that's why it's included.
Wow.
Remember, we're saving money with the new blood process through the lean initiative, Mr. Deputy Speaker. One thing I'd like to ask all members from over there is, why do you think that we should take advice from you instead of the Mayo Clinic, instead of the Massachusetts General Hospital, instead of the Cleveland Clinic, instead of the John Hopkins Hospital? I know the member from Lakeview thinks he's the smartest man in the world, but I think these people are going to give us better health advice in healthcare than you and I over there.